Dr. Pugazhendhi, consultant urologist, Salem Gopi Hospital. So I have to introduce myself. So I studied MBBS, MS, M.S M.Ch in Madras Medical College, all 3 degrees in one college. And I am here to present about prostate. So we have equally male and female, but prostate is mostly it is related to male only. But females are we have. So we should know about prostate so that you can teach your father or your father-in-law. So what is prostate? Prostate is only for male. It is not present in females. So what is prostate? So you have to know the location, the function of the prostate, what are the problems in the prostate, what are the treatments available for the prostate problems. So what is the location of the prostate? So the prostate is located just below the urinary bladder and junction of the urethra. Urethra is where the urine passes from the urinary bladder and to the via the urethra. Urethra is the where urine is passed through the urethra. So this is exactly in front of the rectum. So normally the size of the gland is 10 to 20 grams. So what are the prostate functions? Functions are it mainly secretes the seminal plasma. What is seminal plasma? This is a mainly liquid form in the semen. So what are the functions of this seminal plasma? It is nourishes and protects the sperm. The sperms are produced in the testes. So what are the problems? Diseases can arise in the prostate. That is prostate-megaly. Prostate-megaly means that is enlargement of the prostate, and infection in the prostate is called prostatitis and cancer prostate. These are 3 common diseases in the prostate. So we will discuss about the prostate-megaly. It is what age group people will get this prostate-megaly, what are the causes of this prostate enlargement, what are the symptoms, that is problems and complications, what are the tests to be done, and what are the non-surgical treatments, what are the surgical treatments available for this prostate enlargement. So it is commonly seen after the age of 60 years, 60 and above. Very rarely 55 years we can get this prostate enlargement. So what are all the causes? Is this anything related to food, this prostate enlargement? Yes. If you take more fat diet, it will cause prostate enlargement, because high fat diet will cause increased testosterone hormone. This testosterone hormone is the main cause for this prostate enlargement. Next is there in relation to alcohol? No. Smoking? Yes. Smoking will cause increased testosterone hormone in blood level, so it may cause this enlarged prostate. So we can ask one question, sir, my father had a prostate problem, shall I get this prostate problem? Yes. If your father or grandfather getting prostate problems after the age of 60 years, you can get prostate, the probability is 10%. If your father or grandfather gets prostate enlargement below 60 years, you will get prostate enlargement. The chances is 50%. That's the point here. It is familial only. Prostate enlargement is genetic, that is familial. Family members will get prostate problem. Chances are 50%. So what happens to the prostate enlargement? This second picture shows the first picture, normal urinary bladder and this prostate. In the second picture shows enlarged prostate. The enlarged prostate compresses the urinary pathway. So the bladder is trying to push the urine along this obstructed prostate urethra. So what happens? Urgency. You go to bathroom, you will get urge sense of urination. But if you go to restroom, urine will not come. That is called hesitancy. Even if you started passing urine, the flow of urine is very slow and stops in between, and you will feel incomplete emptying of the urine, and you will feel even after urination the bladder is partially or filled with urine. Sometimes this urine may be mixed with blood. These are all the symptoms of this enlarged prostate. So what are the complications? If these symptoms is not bothered, if you ignore these symptoms, you will end up these complications. What the complications means? These are all the major symptoms. Example, gross hematuria. That means the urine is completely mixed with blood, and recurrent urinary tract infection because of storage of the urine, and stone formation because the urine is already stored in the urinary bladder. You get stone formation, and the bladder is, the pumping capacity of the bladder is lost, so you will get diverticulum. What is diverticulum? Something like the cycle tube is weak, you get some bulge, that's a type of diverticulum, that is bladder bulge. And sometimes renal failure, kidney failure also can come, and acute retention of urine. Totally urine will not come. His urinary bladder is completely filled with urine. So these are all the complications. So what are the tests to be done? The basic investigation, complete blood count, and kidney function test, of course, because the prostate enlargement causes renal failure. So you want to know the kidney function test, urea creatinine, urine complete, that is to know the urine is getting infected or not. And another is the very important investigation, serum PSA. Why it is important? It's a simple blood investigation to show your prostate is normal or getting cancer prostate. Simple PSA. If the PSA is rising more than 4 nanogram, you have to alert. You have to do some investigation to rule out this cancer prostate. So next is the basic investigation, ultrasound abdomen. You can, what is the use of this ultrasound scan? You can calculate the prostate size, the condition of the urinary bladder, if the stone is there or not, bladder diverticulum, and the kidney status you can see in the ultrasound scan. Next is the uroflow. Uroflow is, you have to pass urine in a machine. It will calculate the what is the amount of urine passing per second. It is something like you are taking ECG, for your heart. This uroflow is the something like ECG of the urinary bladder. So you can see if you have to pass the urine in the machine, so it will read. What are we are going to see here? Yes, the first chart, that is the normal curve. That is the pattern of the curve. That is the first one, this normal. The final one, fourth one, that is the flat curve, that is blocked pattern, obstructive pattern. So what are other things you should see? The maximum flow rate, usually that should be around more than 30 ml per second. If it is less than 15 ml, that means that is a block due to prostate enlargement. So all prostate enlargement doesn't need any, they always need surgery. We have some non-surgical management. It is mainly we have to restrict lifestyle modification. That is mainly you have to restrict the fluid intake. What is the normal fluid intake? You have advised by a physician, liters, 3 liters minimum. Yes, that is good. For prostate patient, you have to advise them to reduce the fluid intake because they will having frequency of urination, especially during night time. So we have to restrict the fluid intake for 1.5 to 2 liters. Next is the avoid excess fluids and avoid tea, coffee before going to bed, and empty your bladder before going to bed, and avoid alcohol. Next is the medicines you are taking, no, that should be altered. Example, diuretics. You know what is diuretics? Some Lasix. So it will pull all the excess fluid in the blood and the excreted through the urine. So you have excess urine. So you have to avoid these diuretics. Sedation, sleeping pills, you have to avoid, and cough syrup. Cough syrup you should avoid, and antipsychotics. And one more is bladder double voiding. So bladder is not emptying properly. You have to empty 2 times. Go to bathroom, empty the urinary bladder. Again you go and empty your bladder. So maximally we have to empty your bladder. And avoid constipation, because the constipation also is related to some bladder dysfunction. And avoid long journeys. So you cannot hold urine for long time. You have to avoid long journeys for these prostate problems. So we have some medicines. Alpha blockers and alpha reductase inhibitors, that is given according to the patient's symptoms and prostate size. Sometimes single drug or combination drug. So after starting this non-surgical medical treatment, we have to follow up. Simply you can start the drug, he cannot go home. This we have to follow the patient with regular ultrasound and uroflow. Uroflow to know the result of the medicines. It is working or not. So next is the surgical management. So what are the indications? Who are all the patients for surgery? It's mainly failed this medical management. Non-surgical management is failed. And the prostate size is more than 80 grams. Patient is having gross hemorrhage, that is blood in urine, stone formation, and bladder diverticulum. These are the absolute indication for surgery. So surgical options are, previously they do only open surgeries. They have to open the abdomen, remove the prostate. Now it is totally outdated. We are doing only endoscopic surgery. Endoscopic surgery means you have to go through the urine pathway. You can resect this prostate. Latest updates is the laser prostatectomy. So what are the mainly take home message? Next is the prostatitis. Prostatitis means infection in the prostate. This is not for old age, this is for all age group. 35 male young man with diabetes is more prone for prostatitis. What is prostate? Infection in the prostate. We will have excess high grade temperature, chills and rigor, and difficulty in passing urine. For this patient, immediately admitted, sugar control, injection IV antibiotics to be started immediately, minimum 3 weeks. Next is the cancer patient. This is very common in India, but the main screening test is serum PSA. So what are the main take home message? Only 2 messages I am going to give. So the serum PSA is not included in our master health checkup plan. So every male, the serum PSA to be done after the age of 55. So it should be repeated every 2 years once. So normal level is 4 nanogram. Number 1, this serum PSA to be done every 2 years once after the age of 55. And another take home message is for the prostate, that is prostate enlargement. So prostate enlargement is a simple problem. If you not carrying it, if you ignore it, in one stage the urinary bladder will lose its contractile function. Then the urinary bladder will go for failure. After the urinary bladder failure, if you do surgery for the prostate, it is total waste of money. So the function is lost. So there is no use of removing the blockade. So whenever there is a prostate-megaly, you should attend your physician immediately. Either you opt for non-surgical treatment or surgery treatment accordingly.